Hello, and thank you for joining us for another episode of Matters of the Heart, a program brought to you by Pentucket Medical Cardiology and Haverhill Community Television. My name is Dr. Sunny Srivastava. I'm a cardiologist at Pentucket Medical Associates here in Haverhill, and I'm here with my associate, Dr. Seth Bilazarian. Actually going to talk about today something I'm pretty excited to hear about because, truth be told, I don't know a whole lot about it, and I get asked about it a lot. Previous episodes, numerous times I think, we've talked about smoking and smoking cessation, and needless to say, it goes without saying that we're all motivated to encourage our patients to quit smoking. And lately I've been asked more and more about these electronic cigarettes, and do they work, are they safe, what's the deal with them? And I don't know a lot about them, and so Dr. Bilazarian today is going to tell us more about the electronic cigarette, and I will hand it over to him.
Great. Well, yes, but as you said, we have covered it before, but for purposes of review, let's just take a moment and talk about that subject that you introduced, and that is the whole smoking issue. And I think we both are in agreement, and certainly our professional societies are in agreement, and public health authorities are in agreement, that being smoke-free is the highest recommendation that we can make. So that's clear that what we should say. Patients struggle with smoking. There's no doubt about it. It's a very difficult addiction to quit smoking. I've had patients tell me that they've been addicted to a variety of drugs and alcohol and cigarette smoking, and all of them were much easier to quit than cigarette smoking, so we hear that. I've heard patients tell me that 10 and 15 years after quitting, they still dream about smoking. I had a patient tell me recently that the phone rings and they still pat their breast pocket looking for a cigarette, because that's whenever the phone would ring, they would light up a cigarette. So the habitual aspects of cigarette smoking, the addiction to nicotine, are real and important. And we've talked in the past about some strategies that are successful in helping people quit. We've done a program on this on our program here on the medicine called Chantix, which is a medicine that we think is very good, but works about 50% of the time in helping people quit smoking for a 6-month period of time. There are a couple of other drugs, Wellbuttrin or Zyban or bupropion. Those are all the same. Wellbuttrin, Zyban, bupropion are the same thing. As another method of those medicines are in the anti-depressant class of medicines. And then, of course, nicotine replacement, whether lozenges or the nicotine patch, are the 3 strategies available for us to help people as a crutch, as an aid to quit smoking. But at the end of the day, people have to want to quit. None of those work at all in people who don't want to quit. So that's the background, and we certainly want to emphasize that, and I don't want to suggest that that's not a core and critical thing to really pursue for our patients for both primary prevention, people who have never had a problem, but people for secondary prevention. And then let's just mention one more time, of course, all the things. Why don't you take it? What are the bad things from cigarette smoking, and just for our audience?
So cardiovascular disease, lung cancer, pulmonary disease, emphysema, COPD, the list can go on and on, blood pressure, cholesterol. It's no good. Your wallet as well.
Right, of course. So a lot of our patients are saying that that's been the big impediment to smoking, is the taxes have now gone up so high that cigarette smoking has become a real problem from a financial standpoint.
Yeah. So to boil it down, heart attack, stroke, and lung issues.
Right. The 2 other things that we try to sell,
skin
for women, especially the skin wrinkles, people have a cigarette smoking face. Yeah. And for men, erectile dysfunction. They have difficulty with sexual function with smoking. So there's a lot of good reasons to quit smoking. So a couple times now in the recent past, you said that your patients have asked, 2 situations come up. One is, I'm having trouble smoking. What do I think about trying the electronic cigarette? Mm-hmm. We're going to talk about what that is. And other patients have said, I'm using the electronic cigarette. So what should we be telling patients? And it's a very difficult thing. And I know that recently you did a program on our show on energy drinks, these things like Red Bull and those types of things. And this is a subject that's very similar to that. We just don't know. Right. And that's part of the problem. Now, one of the things that I think I want to be very clear about, this is a real challenge for doctors because we'd like to be sure when we give recommendations. So what do you do when you're not sure? And I think the most important thing, of course, is to be honest. Yeah. But what should we do beyond that? I mean, at the end of the day, people want to know, what can we do? So the problem that we're going to talk about, and I'm just saying this at the beginning to keep this in mind because I really want to have your opinion about this, is that if we think about electronic cigarettes, we would clearly say that they're not safe. But are they safer? And can we use them as a risk reduction strategy for people who smoke cigarettes? And as I was thinking about this, doctors are inclined to say, no, you just shouldn't do that. And I think that that's right and reasonable to say. Yeah. But then I started to think more about this. If we have a patient that's 100 pounds overweight, they're 100 pounds heavier than they really should be to be healthy. Do we say to them, if you can't lose 100 pounds, just forget it? Of course we don't say that. Because if you could lose 25 pounds, that would be healthier. That would be a risk reduction from being 100 pounds overweight. Yeah. So I'm asking the same sort of question here. I'm just asking, I haven't read about this anywhere. I'm just thinking about this for myself. If something appears to be safer, is it reasonable to do? I'm going to tell you what I'm going to say at the end of our program right now, and that is that we don't know. Right. But if you're using this as a bridge for a short period of time, maybe 3 months, at the most 6 months, to use electronic cigarettes to try to get off smoking, I think it's probably a reasonable thing to do. Sure. Again, I can't say it with confidence or certainty, but it's probably reasonable.
Maybe we should back up a little bit and talk about what exactly is the electronic cigarette, what's in it, and what's...
I did want to do that, but I want to get that up front. Okay. But I also wanted you to get thinking about this, because I'm going to ask you at the end of this what you are thinking about. Okay, so let's talk about the electronic cigarettes. Electronic cigarettes are an electronic device that heats water or vapor and has a chemical called polypropylene glycol, and that is got nicotine in it, and we then inhale that, and that is an electronic cigarette. So nothing is burning, there's nothing combusting, and people are said they don't smoke, they vape. Vaping is what the term is, so because it's a vapor. It's said for people who may have lung disease and use a nebulizer and have a mask that puts into a vapor the medicine that we inhale. This is inhaling nicotine. So it's a drug delivery device that people can use that warms up a vapor, that the vapor can then be inhaled, and people can put it in, and they're designed to look like a cigarette. So people put it on, and the inhalation, the drawing in, activates it so that heater then can deliver this vapor so that you can then deliver the nicotine vapor into your lungs. So that's what an electronic cigarette is. And they come in a variety of ways. They can either be used with an electronic powered device plugged into a USB on your computer, or they can be battery operated. But at the end of the day, it's a power source that heats an element that creates a vapor that has nicotine and this other thing called propylene glycol in it.
So just because I don't have a lot of experience with this, so my own education here, you buy one, correct?
Yes.
And how often do you have to refill it, or how does that work? Or
well, they have a variety of different manufacturers that make this. One of the problems is that nobody knows much about these because they're not regulated by the FDA. Yeah. Regardless of where you are on the political spectrum with regard to government regulation, I don't think there's too many people. I certainly would not be one that would argue that this isn't a drug delivery device and should be regulated by the FDA, but it isn't currently. I don't see how it cannot be regulated by the FDA. The question, however, that you asked is how they manufacture. There's a variety of them. They've been around since 2003. Many people are concerned because from a public health standpoint, we don't even know how many people are using these because a lot of the sales of them are via the internet. Many from offshore companies in Asia manufacture these and sell them to the U.S. market. So we don't even know how many people are using them. But yes, you buy this device, and then cartridges can be placed in them to use them repetitively.
Got it. Okay.
So as I mentioned, these were invented in 2003 by a Chinese pharmacist, and there's been a huge interest in them in the United States. Some of the attraction to them that I think really is true is that there isn't any kind of combustion, so people aren't inhaling the components of a burning tobacco. We know that into burning tobacco there are a variety of other chemicals other than nicotine. Also, the other issue, of course, with cigarette smoking is the effects of secondhand smoke, and there are no secondhand smokes from electronic cigarettes. So those are two advantages of the electronic cigarette. We know that when people take cigarette smoke, they are inhaling and actually exhaling carbon monoxide, a very dangerous thing. It's a thing that comes out of engines and other kinds of things that's very dangerous to inhale. So that's something that doesn't come from an electronic cigarette. So these kinds of things are said to be the theoretical advantages of electronic cigarettes. But what's not known is how people are using this. One of the things that's been brought up is that when people first use these devices, they actually get very low levels of nicotine. If you draw nicotine blood levels of people, when they begin to use an electronic cigarette, they feel quite satisfied, but they're getting much lower levels of nicotine than they would be from a cigarette that they would be smoking previously. But what's been shown repeatedly in other studies of people using lower tar and nicotine cigarettes, that over time, people do different things, even unconsciously, to drive the nicotine levels up in their blood.
So they just figure out how to
right, they take
vape it better?
Right, they take longer drags, they hold it in longer,
Got it.
they use them more frequently, so nicotine levels will go up over time with people. So that was another reason why, and again, this is all from my reading of it, trying to interpret it for my own patients, why I think it's another reason why if you are using it for a shorter period of time, you might not get to that point where you're basically just getting back up to the nicotine doses that you were on with cigarettes. Let me just backtrack here a little bit and comment. We said at the beginning this is a tough thing to quit, cigarette smoking.
Sure.
But let me just comment that there's a couple of parts of the cigarette smoking addiction that I did want to comment on that electronic cigarettes do address. There is, of course, the nicotine, which is the chemical that people do enjoy from cigarette smoking. Many of my smoking patients say, I really like smoking. I really enjoy it. It's relaxing. It's one of the few pleasures I get in life. People say that to me all the time. Part of it is the nicotine, there's no doubt. But there is also the other just habit aspects. I mentioned the patient who taps his breast pocket when the phone rings, or people say with their morning coffee they have to have their cigarette, or other times people have to have cigarettes. There is a habit aspect. There's a hand and a mouth habit aspect that people believe can also be addressed by other things like nicotine lozenges or nicotine gum. The mouth aspect can be handled. And I think that there is truly an aspect of the addiction that is difficult to handle. With our other drugs like Chantix, we're really just handling the nicotine addiction, not this habit aspect. So electronic cigarettes have the potential attraction to help with that because it's something that's like a cigarette in someone's mouth if they can use it as a strategy to sort of cut down over time with a definite quit date. We talk to our patients about the only way to successfully quit smoking is to choose an actual quit date. Even if you fail, choosing a quit date, hold your feet to the fire of a level of accountability to try to actually succeed at getting the cigarettes to be out of your life. Right. And the problem that I have for electronic cigarettes is that without that, people will just go on and on. I have one patient that has been using nicotine gum for over 11 years. I mean, he tried years ago with my recommendation that it was a reasonable thing to do, with clearly my strong recommendation that he cut down, actually lay out the pieces, cut down, but he's still chewing nicotine gum 11 years later. So these are real problems for patients, and helping patients sort of transition from one addiction to another addiction is potentially a problem, which makes me worried. But at the end of the day, just sort of circling back thus far, what are your thoughts about how should we counsel patients? What are your thoughts about this? We have a device, just to summarize again, that appears on some levels to be safer than actual cigarette smoking. We don't know about the propylene glycol drug that is part of this, although that is a naturally occurring chemical in our own bodies. It's part of the triglycerides in our own bodies. Of course, it's not in our lungs, and there is one report of someone who developed a lipid type of pneumonia, an inflammatory pneumonia from this, but that's only one case in hundreds of thousands.
Sure.
So I am struggling with trying to just, even though I've spent some time preparing for our show today, and I'm trying to be a well-prepared physician to talk to my patients, the lack of data about the safety is very concerning.
Sure.
And at the end of this, the simplest thing is to say no. But at the end of the day, I'm not really sure if that's right.
Well, I guess, again, I'm just thinking out loud or thinking off the top of my head, the idea that you raise of it being as a bridge, just like the patch or the gum should be, makes perfect sense to me. It's a safer way of delivering the nicotine. You should have it as a goal, as a bridge. I get that, certainly. But I'm not sure I could really be fully on board with, I don't know, I'm just thinking this through out loud. Say somebody, well, get rid of the regular cigarettes, just go to this e-cigarette and then leave you at that. Because I still think it's less harm.
Right.
My recommendation, I think, would still be to get off of it.
Uh-huh.
But I guess I'd be happier that you're doing that versus
So
the other.
I was going to
Yeah,
ask,
I
would you be
mean,
happier for your patients?
Sure. I mean, just like, I guess, not to this extreme, but you look at heroin, methadone, nothing. You'd rather have somebody in the methadone clinic as opposed to going out and getting heroin. But it is just it's another addiction still. Opiate addiction is still there.
I mean, we have to say, I mean, I think we keep saying it, but I want to emphasize it. We're not saying that we think at all this is healthy.
Right. You would never recommend someone who's not doing it.
Right.
Yeah, go try this. That sounds like a great idea.
But as a strategy for risk reduction, I mean, as I was preparing for this and I was thinking about that, we would never tell a patient, if you can't get your ideal body weight, don't bother losing weight. We would never say that. Right. You know, other things that we would say, you know, driving, you know, if, I was trying to think of other analogies for our audience. You know, if a school zone has a 20-mile-an-hour speed limit, of course you should go 20 miles an hour, but if you're going 100 miles an hour and you have someone to cut it down to 50, it's safer. I mean, there are risk reduction strategies that are better, but what's responsible for a physician to share with his patient? I think that what we're saying is something that we can get our arms around, that if you're going to use this as a bridge for a finite period of time, it's probably reasonable, but enter it with the knowing that you could get stuck with this addiction, which is better but clearly not healthy.
Yeah, I think that's a reasonable thing. So I would agree.
Okay. Are there other things about electronic cigarettes that you've heard that from patients that have raised concerns or you have had thoughts about?
No, I mean, I guess some have asked me a lot of the same questions and that you're talking about here. And I never knew the answers and didn't really have a good way of getting the answers about, you know, how much nicotine, you know, how much is in that compared to a pack of cigarettes per day? What's the equivalent? Do you have any sort of information about that? If someone's a pack per day smoker, how much should they be doing on this?
They have sort of, you know, low and high levels of nicotine delivery on the different ones, and there is some data, as I mentioned, that even on the high levels when people start out, they may be getting a low level of nicotine, and I think that's probably a learned response. Right. They actually probably, you know, increase it because they want more of the nicotine drug. It's a drug again. Sure. You know, one of the things I did want to mention is that Boston University Medical Center here in our state did an assessment of the levels of carcinogens in electronic cigarettes and found them to be 1,000 times lower than in regular cigarettes. So from just the cancer risk standpoint, you know, we think like cardiologists, but of course we know, as we've already articulated, all these other risks. The cancer risk looks like it's really dramatically lower with this than it is. Of course, these aren't long-term studies.
There's no good long-term.
No, there's no good long-term studies. But our patients criticize us, you know, for taking a very sort of hard view because we always want all the data. And of course, we want all the data. We want to be able to give hard recommendations. But what do we do in the interval? I tried to also analogize this and ask you about this. You know, something like cholesterol treatment for patients after a heart attack. We think it has a very high likelihood of benefiting the patient and a very low rate of risk. Something like taking a multivitamin or other vitamins that our patients often take probably have very little benefit and probably have very little harm. Yeah. And we say, you know, we tell patients that, you know, I don't have any objection to you taking it, but it doesn't really help. Right. But this, how would you categorize this for a smoker? I think an electronic cigarette, you'd have to say probably safer. Yes. And probably beneficial if you can use it as a bridge.
Absolutely, yeah.
So shouldn't we be recognized? And I'm saying it out loud, but as if I believe this, but I don't know, and I enjoy this kind of dialogue with you in terms of not knowing what to say to our patients. I
think it's a, you know, I have no problem. I often, maybe it's just a familiarity thing. I have no problem recommending the patch or gum to people. But I should think of this in the same vein or the same. It's a nicotine replacement with a better, a safer delivery. You know, you're still getting nicotine with the patch, you're still getting it with the gum, but it's a much safer delivery. So I view it. I guess I should view it the same way. I should probably talk about it more. I don't know if I can fully. I don't know enough yet to fully endorse it.
Yeah, I don't think I would. I don't think I would offer it. But if someone brought it up, I would think I would. You know, say that finite period of time is reasonable to recommend it.
Do you know anything about, success rates with regards to quitting on this?
Very, very, it's incredible how small the studies have, like 10 patient studies, so in incredibly small numbers of patients. But I will say that there is one other caution that I didn't mention that I'd like to say, and you used the nicotine example. Again, we have real issues because many things are coming into this country from outside the United States and manufactured outside the United States, and we don't know about the safety of them. We have an example that was well publicized of actually a drug that is regulated in the United States, heparin, that was made in China and was actually contaminated and caused many health issues in the United States. So nicotine is regulated in the United States. So the FDA does regulate nicotine patches and nicotine gums. But these devices are not regulated at all. So although we'd like to believe that we know what's in them and that it's as I've described it, the safety and potential contaminants and other kinds of issues are a real concern.
I think that's a real issue. And I've seen other products and things like that, when these independent consumer labs break it down, there's all sorts of junk thrown in there that you would never know.
Lead in children's toys has been an example.
Right, exactly. And I think it's very naive for people to think that just because some fancy-looking company is selling these things, that it's all going to be straight and narrow, everything they want, everything they say is in there is in there. I don't know.
So I have come down on this thinking, so just to use an example of something else that we struggle with our smoking patients. So tell me about what you say to a patient who may say, with a drug that we like to use called Chantix as a crutch to quitting smoking. And a patient may say, no, I heard that can cause nightmares. How do you, I'll tell you how I respond, but how do you respond?
We talk a lot about just the downs, the cost, or not the cost, is the wrong way of saying it, the weighing the potential sort of dream issues versus the issues with health issues with smoking. You talk about all the negatives of smoking and the money and things like that. So just weigh those two, and that it's a very minimal side effect to have for the potential benefits.
So so that's exactly.
Say it much better than that, but
but that's exactly the way I would phrase it as well. That yes, Chantix, to use one example, we're not promoting that, but Chantix has nightmares. It has a potential risk of depression. There's even been very rare circumstances of suicide. But if you measure the rate and the likelihood of that happening versus the likelihood of you continuing to smoke cigarettes and having cancer, stroke, heart attack, weighs heavily on trying Chantix for a period of 6 months. So that's where I'm going. I'm thinking with this as well, even with the caveats of not regulating the United States, potential issues with manufacturing and contamination, if patients are going to use this and say, I'm going to try to use this for 4 to 6 weeks or up to 3 months, to really use it as a way to just get rid of this from my life, that seems like a potentially useful strategy until we have more data. And we hope that there will be good studies and be able to either come down either more firmly as a way to recommend it or not.
Who's going to study this? I mean, it's going to be, I don't think we're not going to see the kind of rigorous studies we'd like to see, probably. Right?
Well, I think that one thing that might happen is if the FDA does regulate it, then these manufacturers might be obliged to do it. To sell it, they may have to do something to
we're not there yet, I guess.
We're not there yet. So this was a challenge for me, this program, doing this. But I'm happy I took it on because I wanted to have a better understanding of it. And I felt like I didn't know much about cigarettes, electronic cigarettes. And I feel like nobody knows that much about electronic cigarettes. And I think that part of the issue that we struggle with as a nation is that these aren't being regulated, so we can't even collect information about them, about safety, about effect of using them as a bridge to quitting smoking. And I think that you said it best, that if someone is saying that they are using it already, then we can say, it could be an effective way to help you really get off cigarettes, but you really have to use a quit date and really think of this as a bridge. It may be safer, but the long-term safety effects are unknown and can't be recommended.
I think you're hitting the nail on the head with just be honest, what we do and do not know. And like anything, I often tell people, I don't know what the right answer is. Here's what I think, and we just don't know. And so I agree. But I want to thank you for bringing this topic up because it's something that I've been asked about lately, and I just don't have great answers for it. And I probably still don't have great answers, but at least I've had a moment to think more about it. And so... any other concluding remarks you'd like to make as we're starting to wrap this up?
No, I think that I enjoyed sort of bouncing that off because I had done the reading on it and wanted to bounce these things off you to hear what your thoughts were. And it got me thinking about how patients can be frustrated with us to just take a sort of very black and white no. And I understand that. That's the way we often will say about vitamins, like, there's no data, so you shouldn't take them. And people get frustrated by that. And this is actually... almost has more to recommend it than many vitamin issues.
Oh yeah, I would agree, absolutely. So, well, thank you. I think we are running a little short on the time side, but thank you for bringing up this very interesting topic for me. I think our viewers will actually find it very interesting as well. I think they tend to like some of these topics that are really relevant to their day-to-day living. So that was an excellent review about the electronic cigarette, which we hope may be a viable option and safe option for people to help them quit smoking, which is, of course, a huge detriment to our health. And so with that, we'll wrap this up. This has been another episode of Matters of the Heart, brought to you by Pentucket Medical Cardiology and Haverhill Community Television. I'm Sunny Srivastava, and I was with Seth Bilazarian today. Thank you for joining us.